I feel like physicians for the first time are standing up for themselves and fighting. I know you guys like to see patients and treat them, but I feel like finally we're getting a voice of advocacy and saying, hey, enough is enough, pal. I like that Northwell's making a bunch of money, but guess what? We also have to take care of patients, and we also have to start making some of that money.
What are the problems? There's a lot of market concentration. You're right about this, and
Yeah.
a lot of regulation that favors the Novas and the MedStars and the Northwells
Sure.
of the country. And there's probably three that you speak a lot about.
Yep.
One is market concentration in the sense of, for example, Innova in the Northern Virginia area owns
Yep.
85% of the beds.
Yeah.
In Rochester, there's 1.5 behemoth that basically have everything locked down. So there's no Laport, no Quest. Whatever the major health system says is what happens. And then the other area of concentration that was brought about by the ACA is the merger of health plans.
Yep.
So in Rochester, for example, Excellus controls 70% of the market. In Virginia, Anthem Blue Cross Blue Shield controls over 40% of the market. And then there's regulation. Not every state works this way, but in Virginia, there is certificates of needs. So you cannot go get an MRI and compete against Innova and charge $300 for an MRI without
That's
Innova's consent. And in Virginia, it's basically impossible to open up a standalone surgical center because the big health systems like Innova and Carillion down south and Centera will block you.
that's right. 100%.
So if you could explain to the audience how that's not good for physicians, but worse yet, that's not good for patients and it's not good for the taxpayer.
Yeah, I think if we break it down into two segments, one would be government regulation compliance, and then the other segment would be business strategies. I harp pretty hard on compliance regulation. What you have, let's call it 10 to 12 rules or laws, federal laws and state laws that essentially hand the business over to the larger health systems. Now, the good news is there are solutions to all of these challenges. I think we'll see those solutions deployed over the next 3 or 4 years. And I think they're going to cause a massive amount of disruption, not to patients, but to those health systems. And so that's the good news. The regulatory framework, you did a really good job talking about certificate of need, or AKA con laws. The group or school out of Virginia does a really good job reporting that data. And I'm surprised because you have a really forward thinking governor in Virginia. And it seems to me he just doesn't know what these rules are and he's never heard of them. And I bet if you talk to him tomorrow, he'd go, I didn't even know what this was. Because it seems silly for lawmakers who get up and tell voters, Ro Khanna did this yesterday, and so did Bernie Sanders and a couple of others. And they stand up and they say, our health system stinks. Everybody's paying too much for coverage. And then I've sat with Bernie before, and I go, tell me why you limited supply of physician-owned hospitals during the ACA. Like, why didn't you support that? He doesn't answer the question.
He doesn't know.
Yeah, he looks at you. I literally had this conversation with him. And then his person walks over and goes, hey, Dutch, this conversation's been great, but we're done. And I'm so disingenuous.
So I'll tell you why Glenn hasn't touched that. I don't know him personally. I'm very good friends with one of the best orthopedic surgeons in the country, Randy Payton. And he's good friends with Glenn. They live in the same neighborhood. They go to the same country club. And so I know that the governor is very interested in all these issues. But whenever this is brought up, Innova, Carillion, it's now the Medical College of Virginia in Richmond, sit at the table with the governor and his aides and say, hey, if you squeeze us hard, we're going to have to terminate 15% of our workforce because we're barely making it. Our margins are so tight. And remember that 50% of the workforce is all female and they have nice middle-class jobs in every county in the Commonwealth. And they won't be able to find jobs. Do you think that in Virginia, you can't get reelected, but do you think that will be good for your political future?